worst healthcare systems in the world, and we have to be ashamed of it. The important thing is to accept it, that we have to be ashamed of this, what we are in. And the base reason is something which we have to understand, is that hardly any government is there in this world which doesn't accept citizens' health as its own concern. Everywhere government is the payer or insurer of all citizens in their country. Nearly everywhere, including Sri Lanka or great parts of Bangladesh. But we are far away from it because we spend nothing. And over the years, policymakers have ignored the social burden of health, and thus causing tremendous damage to the country. The spend on health by government of India is about 1.4%, out of which 0.9% goes in paying salaries or managing buildings. So 0.5% is the additional incremental cost on health that government is paying. Average GDP to health ratio has to be minimum 8 to 10%, and governments have to spend minimum 5 to 6%. And we are at 0.4. And that tells us everything. So that's the reason why this is happening. But then, blaming someone or blaming the government is not a solution. It's nonsense. What is government? It's us, na? We all together is government. We elect our people who lead us. So we cannot blame somebody else. There is no some other person or something else. The reason is that we need to create awareness about this, create more understanding about it, and help everyone. And now many governments are going at, like Rajasthan is creating a PPP with Narayan Hridayalaya to say, okay, you manage my primary healthcare centers. And that's going to work. Over a period of time, it's going to work well. You had a great scheme in Karnataka where farmers paid 5 or 15 rupees per month and they could get a cardiovascular surgery worth 100,000 rupees free. So we started to see a lot of work done together with private sector. It's never easy. I have myself done a very, very big partnership on tuberculosis with RNTCP on MDR-TB, and how to ensure that MDR-TB is eradicated from this country over the next 2 or 3 decades. And huge partnership we have got into. Has it been easy? No. There are difficulties because there is a trust deficit. There's somebody who doesn't trust the private sector sector doesn't trust the government. But at a human level, at the connect level, it's all about our own citizens. So we have to go beyond this and try and make that effort. So it's starting to work, but we will have to create a lot more pressure in the system of society as well as government together to work on this. And for example, I commend the Prime Minister to talk about Swachh Bharat Abhiyan. People are looking at cleanliness on the road, but imagine if we get even half as cleaner as we are, communicable diseases in this country will go down by 3/4. That's the impact. Why Delhi is suffering chikungunya and with total apathy of the citizens as well as the government, not just the government. There's no sense in blaming the government all the time or saying MCD has not done this or this has not done that. That's politics. Do we keep our areas clean? So that kind of partnership is required for us to get. Primary healthcare center is basically our own houses, where if we manage our houses and surroundings and society better, that's the primary healthcare center. And actually primary healthcare centers should be turned into secondary healthcare centers, where unless you fall sick, you don't have to go, but avoid sickness. So there are, there's a deeper issues involved, but I don't think I answered your question directly, but these are important issues to discuss.